If you can really try to identify the structure, then you want to match the input to whatever structure that's hurting. Then you want to reset if there's inhibition present, so wake up your glutes, reduce co-contractions, and then after we're done with that, you rebuild the pattern, get back to progressing your load, reload the system.
Welcome back to another episode of Past Your Prime, the podcast for active adults balancing training, rehab, family, and real life. I'm Alex Keicher, pro volleyball player, busy dad, part-time knee pain case study, here with Craig the PT Smith. He's a physical therapist, life professional, also my personal coach, trying to make me better day in and day out. If you haven't done so yet, go follow at Past Your Prime Podcast on IG. We've posted 3 times there and they've all done really, really well. So number 4 is going to be even better and you want to be there to experience it.
100%. 100%.
Today, we're talking about why your knees hurt when you squat or lunge. I feel like a lot of people do this. I myself have Googled this. And so we'll cover what's actually causing it, how to tell which structure is involved, and what to do to get back to pain-free movement, which has been my focus for like the last 3 months. And man, I'm a recurring injury just in human form. I was recently listening to one of our past episodes on why rest doesn't help you. And I'm quoted in there saying like, I have never done injections. And now I've done several. So that no longer holds true. If you heard me say that, I've now had a cortisone injection, and I'm doing some other injectable therapies to try and rid myself from some pain and inflammation. But that's not what we're here to talk about today. Anyway, I haven't let Craig say anything yet. So I'll ask him a question and he'll help us understand what are the most common causes of knee pain with squatting or lunging?
When most people think about knee pain with squatting, I think the immediate thought is to go towards a patterning issue. But I really like to understand which specific structure is actually causing the issue when somebody says their knee hurts. And so, I mean, just right off the bat, you want to identify which structure is actually hurting you. So if it's the knee joint, the joint itself, which we'll call traumatic synovitis, your knee joint's actually going to be swollen and feel stiff. A good portion of individuals that I've had, especially if they're doing heavier squats, the joint was the aspect of it that was causing their symptoms. The other common one, which I think you've talked about before, is the patellar tendon or the quad tendon.
Yep.
And so the quad actually has a big tendon that your patella basically resides in. And on the part that's connected directly to the muscle, that's your quad tendon. And the part that's connected from the patella to the tibia, that is that's your patellar tendon.
Yeah, I've had a little bit more of the patellar tendonitis, whatever you want to call it, comparatively to the quad tendon. But knock on wood, I'm sure I'll get some quad tendonitis now that we're talking about it.
Yeah, of course. Yeah, I mean, you always get it, right? I always think on that one though, you can really tell if you put pressure on the tendon, it hurts. Like
Yeah.
it's actually quite painful, and you can also get it with other exercises. Like if you're doing something else that actually also loaded the quad, it typically will hurt as well. The other big one is your patellofemoral joint, which isn't the same as the tendon. That's the interface between your patella, that floating bone on top of your knee, your kneecap, and the femur underneath it. So that's actually a joint. And typically what happens with that one, you'll feel pain, but you'll feel pain in a very specific angle of load. And it can be dependent. So you have to, I think that can sometimes mimic a patellar tendinopathy.
Yeah. And I've had a little bit of that one, commonly known as patellofemoral pain, PFP, is how you might hear of that one. And yeah, I think it was deep squatting and the leg extension machine seemed to flare that one up on me specifically.
Do you remember which like what was the arc when you're doing the knee extensions that it hurt?
It was just like during the movement itself. I can't remember specifically which. I haven't done those in so long now that I've forgotten what they even feel like.
Yeah, it's funny how often that's an exercise that hurts somebody. Like it's crazy common. The last one that's always present with knee that you want to rule out is this meniscus. With anterior horn meniscus, it's just going to be most painful when you extend your knees, and then posterior horn, it's going to be when you do more of a deep knee flexion, or if you have a little bit of a twist on it, that can typically provoke the posterior horn of your meniscus.
Well, and if you do a big twist, it'll just rip right off.
So stupid. Uh, but yeah, if you do a thorough exam, it's actually pretty simple to figure those out. But as you're at home and you're doing it can be a little bit more difficult. So what I always think of, if it hurts when you tension it, just immediately tension it. I start to think more patella, like the tendon. If it hurts when you if it hurts when you really extend your knee, like your leg straight and you lock your knee back, you have to rule out meniscus. Like that's really the biggest thing. And you really don't want to snap your legs back. That's such a common mistake that people will make, is when they get to the top, they'll forcefully extend their knees. That's a really common one. And then if it just feels like your leg is swollen and you can't produce power on that side, you most likely have a joint issue. So those are just like three easy, quick ways to basically go through and figure out which one's actually one bothering you.
And yeah, you've probably done no less than like 30 knee exams on me over however long, 10 years plus. And every time it comes back like, hey, you just got a little bit of swelling in there. Stop being a baby. You'll be fine.
I do tell you to quit being a baby quite a bit. I'm like, why are you trying to get attention?
Yeah.
I
Um,
think that people get swelling in their joints a lot more often than they realize, actually.
right. Yeah. Yeah, especially if you're an athlete, let alone an aging athlete, like it's pretty much inevitable. Almost every movement that's an exercise movement, whether it's just walking, sitting, stand, I mean, they all use your knees. And so obviously when you're loading it with a squat or a lunge, you become more susceptible to some of these diagnoses. So kind of once you identify the structure, how do you treat it specifically when looking at squat patterning and lunge patterning?
Well, this is where you really want to match whatever structure you think it is with what the intervention is. So this would be another way, if you're not sure which one to do, if any of these things improve your symptoms, that starts to make you think this is the tissue that's causing your pain. And the one just right off the bat that I think is just the most useful one to people, for people to have in their toolbox, is joint traction. And you can traction your knee in a variety of ways, but the easiest way is to take a leg weight, sit on a box, and just let the leg weight pull your knee, and it'll traction it. And as it's getting traction, it'll typically feel really good, very relieving. Have you done that one?
I don't know that I've actually done that one. I've seen people at the gym do that one, but yeah, I'm surprised. I've also, once again, knock on wood, haven't had too many major knee joint irritations. I had that one little bout and it seems to have cleared up pretty recently. So, um, yeah,
Yeah, so I think that with that, and I'll I always like to have the leg weight one first because it's just the easiest setup. You can also use a band where you wrap it around your knee, and then your knee is in a flex position and you lean weight back. I have videos for both of them, so we'll just, if you're going to be watching this on YouTube or on Spotify, you'll be able to see the video right now showing how those are done. But the biggest piece on those is it desensitizes the synovial lining of your capsule. And so it actually it has a huge therapeutic benefit, and it will help to stop what's going on, this irritation that's happened to the synovium that's basically keeping the joint swollen. So it's actually incredibly effective. And if you think you have a hint of it, it's one of the safest and most useful things that you could do.
and that is where the term synovitis comes from.
It is. You got it. It's dead on. So, and it's kind of funny because people will also, you can call it a traumatic arthritis as well, but it is interesting that how effective and how easy it is to calm those down. But if people don't calm it down, it can become a horribly painful. Now, for the tendon, you've had to have seen people playing volleyball who wear those straps across their tendons,
Oh, yeah.
like the front of their knee,
Yep.
and that's one way to unload it. Go ahead.
No, I've seen, yeah, isn't it just called like a patellar strap or something like that?
You'll hear a few of them. You can call it a chopat strap. You can call it a patellar tendon strap. It's the same thing. Basically, you're getting
That or
compression
they're
on the
wrapping up
tendon.
the pre-wrap and rolling it up over their patellar tendon.
Same. It's literally the same
Yeah.
thing. The interesting thing with those is the tension gets lost. And so when you lose the tension, it's kind of funny when I see people using that because I don't find it as effective as just getting a cheap strap. But I don't
Part of me
know.
thinks it's like just for looks, like, oh, look, I look cool with my pre-wrap on my knee. I've never done it, so I'm obviously
It's
not cool, but
well, it's interesting how often it's pink.
that's
Like I've
true.
seen, it's like weirdly pink often. So I don't know the decision on that one, but yeah.
Because maybe,
Uh,
yeah, if you use the skin-colored ones, it's like, why do you have pantyhose wrapped up around your knees? That's weird.
yeah, yeah, it's a decision. I love it. Now, if you don't have the strap, the easiest thing is to cross friction it. And so you push down on the tendon and you find the spot that's tender, gently go across it. It'll feel a little uncomfortable when you start, but that will also knock out some of the pain that the person that you'll experience. But the cool part with tendon is actually as long as the pain's not above to me like a 3 out of 10, and as you start to load it, it starts to go away. I think that's totally fine. Tendons like load, so it's okay as long as you do it, it actually reduces in pain with more reps.
I like how you say that the cross friction is only like slightly uncomfortable. I tend to disagree and think that it's extremely uncomfortable, but maybe that's just me and my soft, sensitive muscles and tendons.
You don't have soft muscles. You
Yeah,
got big muscles. You're
they're
good.
sensitive though.
They are sensitive. They are sensitive. But if it starts to build though, that's actually not a good thing. That's overloading the
Right.
tendon. You'll just make it worse. So just I think that's the big one where people will hear that of like, oh, I can push through the pain on this. It shouldn't feel worse and it should actually get better as you're doing it and maybe even go away. That's typical of a tendon. Whereas if it's like
Yeah.
joint or meniscus, it'll only get worse.
And I've heard, and you can confirm if this is true or not, but like the tendons need load to strengthen. It just can't be overloaded. You can't go, a max squat or a max lunge, or even a max isometric. You've got to be very controlled and mindful of the load, but it does need to be loaded to help bring blood flow there, and help the tendon itself heal.
Worst cases I've seen have been people who took time off, like way too much time off and completely unloaded, especially when it was in a very irritated state. And so you can get where the tendon becomes incredibly, incredibly unhealthy. And those are dramatically more difficult than people who continue to load it. And so it's just balancing it. It's one of the rare structures that benefits from some level of discomfort as long as you're not overdoing it.
Yeah. 3 out of 10 is a good scale, I think.
Yeah. Yeah. Now the patellofemoral joint's a little bit different. With this one, these can be actually really tricky depending on the level of damage that's happened. And if it's more just that's another irritation to the joint, that's one thing. But if it's that you've actually damaged the surface, it can be difficult. And that's where I like to really start with working the pain-free range and staying out of ranges that actually hurt you. And it can be it can be variable. And that's why you have to find the angle of when you load it that it hurts the most and you just work around it. So you can do isometrics above and below the place that actually hurt you.
Yeah, so that could be like a calf raise isometric or even a lunge isometric to load the quad. This is one that I think a lot of jumping athletes, whether they know it or not, end up dealing with. And yeah, just being able to kind of keep it under control obviously can keep you playing your sport. But at the same time, you want to kind of try and maintain that therapeutic gap as much as possible to not irritate it more than it needs to be.
What makes you think a lot of people are dealing with it? What have you seen?
No, I mean, I play with a lot of people that do a lot of jumping, and just from my presentation of PFP, it's usually been on kind of like the inside of my knee,
Got it.
yeah, I just notice a lot of people are dealing with that same thing, and like, what do I do for my PFP? And yeah, I think isometrics are usually what I have implemented in the past just to try and stay ahead of it.
Interesting. Yeah. So, and you're talking a little bit more about like a patellofemoral pain syndrome, like where they have
Yeah.
pain more on the front. Yeah, and that's actually a good point. This will be slightly different, like where it's the patellofemoral joint. It's like the surface between the two of them. Um, but yeah, like I would totally agree with you. I think that that's actually not. I don't think it's uncommon either, and I think it can be really poorly managed. So what I look for on this one specifically is going to be which angle hurts them. Is it when you see people with the patellofemoral pain syndrome? What do they normally do that makes it better?
So like, yeah, like same thing, like lunge, isometrics, yeah, kind of like you outlined before, working those muscles above and below the knee joint. I specifically had to use a taping method to unload it for a couple of weeks just to once again build that therapeutic gap up. But yeah, it's been probably 2 months since I've needed to do that, and I haven't had a reoccurrence of it, which is great.
That's a big deal. Yeah, that's actually a huge deal. You've not had any meniscus issues though,
I don't think
right?
so. All 30 times you've checked my knee, they have been intact. Although you always say that everybody has a little meniscus tear. I don't know if I believe it, but I'm not getting an MRI to check either.
I really, yeah, I think that over time, it's one of those structures that I don't think was designed as well as we would hope it would be. It has to glide out of the way for your entire life between your femur and your tibia to not get smashed. So it's a hard job for the meniscus to do. And I think eventually you start to wear it down. So degenerative tears are really common, but if it hurts, right? And it hurts, especially when you extend your knee, it's really useful to use a heel lift. So like putting like a plate underneath your foot when you're doing your squat or using like a 2x4 underneath your heels. It just prevents you from going into full knee extension. And we definitely went into a whole deep dive on the meniscus back in like the teens of our episodes. If you have pain with end range knee extension and when you're squatting heavy and you find that you're forcing your knees back, that's probably the most common problem I see with it. You can really fix it by avoiding it for a period of time, and a heel lift works incredibly well.
Yeah, that's what tells me my meniscus are probably okay is that I squat so much more poorly with a heel lift.
Yeah, that's funny. That's awesome. You have great form though. Like it's like your depth is so good.
Thank you.
Um, yeah,
But I
yeah.
haven't been squatting to depth to try and heal some of my other leg issues, but
I know.
knees are
I
feeling
know.
good.
Your knees are solid. Well, and so the other aspect of your meniscus is your posterior horn. So that's this back portion of your meniscus. That typically you hurt it when you flex or twist on it with flexion. And so it's really just avoiding that, letting it heal. And if it's not locking, if it's not hurting, it's just staying out of the range where you put compression on it. And the way the meniscus is formed, you have these hoops, basically hoops that help to take and put stress around the entire meniscus. And so as long as you avoid end range positions, you're not going to be getting nearly as much load on it.
So, okay. So, what if the exam is looking clean? This is something I hear quite a bit, but the squat feels off or tight.
I usually think of that as a control issue. And I think that there's really three things that I really like to just work through. The first one is, and the most obvious one is glute inhibition, which is, I think everybody's obsession is just fire the glutes if you feel like you can't squat without symptoms. The other big one is co-contractions, where we talked about that a little bit when in our muscle inhibition episode, where you can have a gamma loop dysfunction and then just poor patterning. And we can hit all three if you want to.
I just want to know more about what a gamma loop is. That
uh,
sounds that's fun to
yes,
say.
it is. It sounds nuts, but that's where your muscle spindle sends off information to you to your spinal cord. And then as it comes back down, it informs your motor neuron pool which muscles it should be turning on and how much. And that becomes dysfunctional. So you have parts of them that fire too much, other parts that don't fire at all. And it's like what it'll feel like is if you have portions of your quad that feel super tight, other portions that don't feel like they're firing at all. That loss of your ability to actually get the quad muscle to fire normally, that's your gamma loop. And oftentimes it's more you'll find that you're more maybe more prone to cramping in that muscle, or it'll feel like the outside of your quad is like way more loaded than like the inside. I think that's more of like a gamma loop dysfunction.
And then I know you mentioned glute inhibition. I guess the question is what's happening there. And then I'll just say from my experience, I think that's a big reason why a lot of my knee pain has gone away is that I have really prioritized glute activation prior to doing any squatting activities. But anyway, what's happening with glute inhibition?
Well, glute inhibition, when it happens, something is causing that muscle not to turn on when it's supposed to. So it's either a timing issue or it could be a full blown inhibition. So the weird part with the inhibition is what I'm saying is it's not a strength issue. It's not that your glutes aren't strong. And that happens a lot with people will come in and they'll think that they'll be frustrated because they've done a lot of glute exercises and then we'll do testing on it. And it's like they can't perform any level of resistance. And I think what happens is either a back irritation or some way that they've trained in their past has made them predisposed to their glute muscle just literally shutting down. Something makes it so that they can't turn it on to the same level as they should be able to. And so doing activation is a big one and doing it right before the activity because you don't know how long the muscle will stay as active as you need it to be. So trying to tie that glute activation right next to the squat, like maybe right beforehand, is really useful. The other thing is to use cues and visualizations to help get that muscle to be active. One of my favorite ones is imagine you have like a towel with a wrinkle in between your 2 feet, and imagine that without really moving your feet, feel like you're taking the wrinkle out. And that's a way to really engage your glutes while you're squatting.
I got a good visualization of that, and I hope that the listeners can also understand that.
So like whoop, it's like it's
Yeah.
separating.
No, but I do feel that that has made hopefully a major change in my knee pain. And just like you said, I'm doing my glute activation just before I'm glute into activation and straight to the squat rack. So yeah, that's felt really good for me, although it can look a little bit awkward when you're squeezing the glutes to try and warm those bad boys up.
Everybody's like, Alex has to go to the bathroom, I think. Yeah, there's a problem here.
Oh goodness.
If
And
your knees
then
dive in, that's a big one too. Like if
yeah.
you've probably seen this, but it's like people's knees coming towards each other when they're squatting. That's an obvious hey, your glutes aren't patterning it well or they're not active at all.
And then what about the tight feeling that you had mentioned, the subjective feeling of tightness when squatting or lunging?
I think the most common one is that you're getting muscles that turn on when they're not supposed to. And it's such a common issue around the knee where your hamstring and your quad will start to fire more than what they're supposed to, and that's a co-contraction, and co-contractions are significant dysfunctions that can make it feel like your squat feels super tight as you go down. And so what I always listen for is somebody tells me they can't get full depth, or as they start to go down, or like when they're doing their squats, maybe body weight before they start to load it, if it feels super tight with that, like even harder than when they put load on it, they have developed a patterning issue that can really lock up their squat. And that my favorite way to correct that is to do something that forces their muscles to fire in a different pattern. So you can do things like put a band underneath your butt and push down into the band instead of I like your face on that one. Do you understand what I meant by that?
I was trying to visualize and I think I've got it now. Like you're
Yeah, so
sitting on a band.
yes, it's a different way, and what I try to look for is people say, "Okay, it feels looser." Another way to do it would be to do a band around the knees, heel lift, and then have a goblet squat, and as you go down, push the weight out. That's another way to repattern it. My absolute favorite way is to do a sit to stand, which I think we just did that with you.
I I did them what on Thursday last week, I think.
How'd it
Nah.
feel?
It was really difficult because the benches are way too low.
Too low for you?
Yeah, yeah. I mean, well, especially because yeah, you lose that that, I don't know, like just that isometric part and getting up from the isometric part of the sit to stand was extremely difficult.
That's funny.
Maybe because I had 225 pounds on the bar, but man, was it difficult. So I did end up having to move to a box after a set of very low bench sit to stands because I
Yeah,
just couldn't do it.
I freaking love it. So what I always look for, if the person can't get depth, then I really like to use the bench, have them go down to the bench, completely sit down, and then stand back up. But I also really like it if they feel tight. That works really well as well. And it's really just focusing on trying to make it feel loose is always the idea I look for. And oftentimes when people will do this, they won't realize it, but they'll really squeeze all their muscles almost like as hard as they can. And it's not necessary, and it can actually induce a patterning issue that makes squats hard and painful.
So kind of like poor muscle coordination.
Yeah. Yeah. And honestly, like injuries can lead to that. If you have a pain in your back can lead to that. It can also happen just because you're maybe out of practice with doing the load. So there's a lot of reasons why it can happen, but my favorite way to squat and to warm it up is really to do like the sit to stands until my legs feel like just like nice, loose, not tight at all. And then I like to progress load. Because if you can't get depth, I mean, why are you loading it?
I agree. And then, yeah, after those ridiculously hard sit to stands, the box squats just seemed like so easy. All I had to do was like add maybe 4 inches to
Yeah.
how deep I was going. But yeah, it just got significantly easier, probably because I almost over warmed up with those super deep sit to stands.
That's like the best. You overwarmed up. That's a good thing to hear from you.
Yeah, it was accidental to say the least. But and then I think you had alluded to it, but what about people that can't get depth at all?
Yeah, I mean, there's a few different reasons, but the first one is like figuring out what issue is causing you to lock up. So the heel lift works really well if somebody feels like they're getting tight as they start to descend. If you put a band around their knees, that can help to unlock their glutes, which will help them descend. And then if it's more just their patterning is a struggle and they don't feel confident, sitting down, a sit to stand is perfect. Like all of those will help them get depth. But you want to get whichever one allows you to get to at least parallel without symptoms is the one I like the best.
Okay, so yeah, just kind of try a smattering of those and see what works.
Yeah, and one's not better than the other. It's whichever one makes you actually feel the best.
And we didn't talk about this before, but the one that I hear the most is like, I've got tight hips. I need to unlock my hips. What do you say to the locked up hip folks?
It's always kind of interesting because when I have somebody say, they'll say they feel tight, but they feel tight and they'll say that they've lost motion, but the way that they say that they lose motion is actually what shortens the muscle. So your hip flexors, right? They connect the front of your pelvis to the femur. So you have your TFL, sartorius, rectus femoris, adductor longus, pectineus, adductor brevis, and your iliopsoas. Like those are all the muscles that flex your hip. And so it's funny when people will say it feels tight and they've lost motion, and it's when those muscles are shortened. So it doesn't really make sense what they're saying, right? So it can be a variety of things. It can be that the muscle's overactive and firing when it shouldn't. Should that be like a co-contraction? Or it can be that they actually have an impingement on it. So it's like getting overly compressed.
Yeah.
What I typically find it's a combo of both. And your TFL is particularly prone to becoming overactive in the squat. So if you feel it in the front of your hip, doing something where you're doing like a glute med activation without feeling it in the front of your hip is like really, really useful. Uh, but it's most likely not tightness. Yeah. I mean, it's just kind of funny. It is
Yeah.
like the most
You can
common
have
thing I
that
hear.
feeling, but it's not a real thing. You just make it up. That's what we're telling
It's
those
just in your
folks.
head. I know. Well, it is funny how often people say they feel it in the front of their hip and they'll say that I just have tight muscles. It's like, it's not really a tight muscle. I mean,
Yeah.
you're literally describing it when the muscle's in a shortened position. You have a muscle that's activating when it shouldn't be active.
Yeah, and I certainly had that with my little adductor issue where I couldn't bring my knees to my chest for a little while, and through whatever I'm doing, it's starting to subside. So Always happy when things are getting better.
Well, and you have a tendinopathy, and when you shorten it and you bring your femur towards your pelvis, you're compressing the tendon that hurts. And so oftentimes I think it's just that the person has a tendon injury and they don't realize it.
Yeah.
Yeah.
Okay, to close us out, can you summarize kind of your overall framework for fixing knee pain with the squat and the lunge?
Yeah, it's pretty simple. So if you can really try to identify the structure, and if you are struggling to identify the structure, you can try some of the different inputs, but then you want to match the input to whatever structure that's hurting. So traction for the joint, friction, and some type of load manager for the tendon, isometrics, pain-free zones for the patellofemoral joint, and then heel lift and avoid extension if it's the anterior horn or meniscus. After you do all that, then you want to reset if there's inhibition present. So wake up your glutes, reduce co-contractions if you're getting it. And then after we're done with that, you rebuild the pattern. Just try to make it as smooth. And I always think as loose as possible. So it should feel like everything is just kind of performing and you're not getting this excessive tightness that doesn't make sense for the level of activity you're doing. And then after you're done with all of that, get back to progressing your load, reload the system.
Love it. If your knees hurt when you squat or lunge, don't assume it's just age, like it is for me and Craig, or wear and tear. We'll figure out the structure, fix your control issues, rebuild your pattern, and then you'll be able to squat 405 pounds with ease. Maybe not, but
That's probably true.
yeah. I think Craig has a pretty cool blog on knee pain over at smithperformancecenter.com. You can check us out at pastyourprime.com as well as at Past Your Prime Podcast on Instagram. We're on YouTube, Spotify, and pretty much anywhere you can get a podcast. Aside from that, I think we will see you on the next episode.
PYP, baby.
Peace.